Hello. When you decide to do IVF, you're not alone. What you're going through right now, I've gone through as well. Like you, the doctor prescribed PROLUTEX. I will show you all the steps on how to prepare and apply it. You will see, it's not difficult. A few words on PROLUTEX. It is used to support the endometrium during embryo transfer until the pregnancy test. It is available in a box including 7 injections. To do PROLUTEX injections, you will need to purchase an extra 2.5ml disposable syringe with a removable large needle for suction, and small thin needles, insulin type, for subcutaneous use. Store PROLUTEX at room temperature, protected from light exposure. I keep them in my drawer. The dose should be taken every morning at the same time, unless your doctor has given you different instructions. Choose a fixed time that suits you. Before we start, wash your hands thoroughly with soap and water. For the daily dose of PROLUTEX, you'll need the vial containing the liquid, a 2.5ml syringe with a removable needle, a small needle for subcutaneous use, cotton, alcohol. Now let's prepare today's dose. Remove the cap from the vial containing the liquid. Remove the protective cap from the syringe needle. Push the needle into the center of vial's rubber stopper. Invert the vial and draw the liquid by slowly and carefully pulling the syringe plunger. For easier suction, lower the needle tip to immerse it in the remaining liquid inside the vial. Make sure all the liquid is in the syringe and the vial is empty. Then remove the needle. Carefully close it again with the protective cap, pull it out of the syringe and throw it in the special bin. Now place a small needle on the syringe and remove the protector. Hold the syringe with the needle upwards. Tap lightly to help any air bubbles rise to the top. Now gently push the plunger to remove the bubble. If you need to leave the syringe down, make sure you put the protective cap back on. Let's do the injection. It's not as difficult as it seems. The injections are done in the abdomen, in the smile below the navel, 2 to 3 fingers right, left or down at a different spot each time. Pick the spot and clean it with some cotton and alcohol. Lift the skin in the area and insert the needle with a steady and firm motion, vertically or diagonally. Don't worry, it is very thin. Now push the plunger gently and continuously without stopping until it stops coming down. Once the syringe is completely empty, remove the needle. That's it. Press gently with the cotton on the injected area and massage lightly for 2 seconds. Cover the needle with the outer cap you held aside. Used syringes should be disposed of in a special bio-waste bin. If you do not have access to one, keep them and ask Embryolab to discard them safely through their bio-waste management system. See? It wasn't that hard. Here you will find more useful tips. For any further questions you have, you can always contact Embryolab.